everybody. Welcome to Bridging the Information Gap, our bi-monthly PDA webinars for leadership to get fully informed on what's going on in the association. I'm Ward Blackwell, Executive Director, your host for the evening. And before we get fully underway, I'm going to go over a few things just basically that are procedural for how we handle these. So all of you who are in the audience are in listen-only mode, as the nice lady said. You can ask questions by typing them into the question box that is located to the right of your screen in the control panel. Just type it in there at any point during the hour-long webinar. We will take your questions at the end, direct them to the appropriate panelists, read them out loud, and hopefully you'll get a good answer. For anybody who doesn't get a question answered or who doesn't want to, but feels like they missed something, just remember all this is being recorded, and you can always follow up later and see the entire video on the YouTube channel, which is also linked to our webinar and video library on the website. With that said, do the little commercial part now. This is sponsored by PDA Member Advantage, a program of the Pennsylvania Enterprise Resource Corporation, a subsidiary of PDA. And tonight we want to specifically point out one of our PDA Member Advantage companies, CLIM, which offers our members exclusive discounts on waste management services. And we'll be doing a very special project that you'll hear a little bit more about tonight during the Three Rivers Dental Conference coming up. So with the commercials out of the way, I'd like to introduce our panel for the night. I'm going to be actually giving a little presentation myself in addition to hosting. You'll also hear from the chair of our Enterprise Sigma team, Dr. Charles Incalcaterra, Dr. Linda Himmelberger, our Governmental Relations Chair, Dr. Rockwell, our PDA President, Dr. Janine Burkhardt, who represents PDA on the ADA Council on Access and Prevention, and Dr. Jim Boyle, our trustee, and Dr. Gary Davis, who is managing the campaign of Dr. Boyle to become ADA President-elect. That is your panel for tonight. Now, to kick it off, I'm going to take the spotlight that I already have and run down a couple things that some of you may or may not be aware about that relate to the tripartite governance structural change that the PDA is currently undergoing. Now, it wasn't that long ago, it's last year, in fact, the PDA made some bylaws changes that made some big changes in how we are going to be structured. We've been 4 levels, ADA, state, district, and local for a long time, but now it's essentially condensing down to 3. In most cases, that's going to mean there will probably be no more district society. In some cases, essentially all the local societies are combining, and the former district is now the local. The rationale behind this, primarily from the Governmental Relations or Governance Task Force committees, pardon me for confusing them, they had the same chair. It was essentially a lot of those benefits from the local and district are redundant across the state, and most of the task force members and the board agreed you really are getting most of your benefit from that local society. That's where membership really matters the most. And frankly, we had a software issue that required us to make this kind of change to be able to take advantage of the big investment the ADA is making in Salesforce Fontiva software. So what is this going to mean in practical terms as far as the changes you can expect? Well, one of the big changes relates to this definition we will have of what is an active local society, because if we're going to have benefits delivered at the local level, it has to be able to do so. The 5 things you see on your screen are the criteria that are in the bylaws now for a local society to be considered active. When our membership department started gathering data to review this, to present to the board of directors, essentially what they found, nobody's doing all 5 very well. There are a handful of our local societies who can technically check all the boxes. Almost all of them, though, are at least deficient in at least 1, and there's got to do at least 4 out of 5 to be considered active. Maintaining bylaws was the big one that a whole bunch of folks seem to be missing on. And communicating regularly with the PDA is another one. Several of them are missing elected officers. In the end, we found quite a few who just didn't make it work. Next slide, please. So based on those criteria and the research that PDA staff did, we found a number of inactive societies. They were contacted, and the ones you see here have said, okay, we can get it together and meet those criteria. A lot of them have done many of those steps already. We've gotten some bylaws filed. We've gotten a lot of better communication. And believe me, the communication, I think, is the key here, because some of them were already doing things, but no one knew. The communication just wasn't there. Then we have the other category of societies that essentially inactive, wasn't really practical for them to get active, or there weren't enough interested members to elect officers, what have you, or they voluntarily realized they would be better off merging with another society that could actually make sure they got the benefits at the local level they were seeking. Next slide, please. So amongst those inactive societies, based on those determinations that are merging, the 7th trustee region, formerly 7th district, everybody there will be doing, they'd already done it previously in the 8th trustee region before the bylaws changes even took effect. And then you'll see a few other ones here merge. Most of these are voluntarily making this decision on their own. A couple of them we simply haven't heard from, and the board of trustees, excuse me, said, yeah, okay, without hearing from you, we're making this move, and you have a certain amount of time in which you can let us know if it's not going to be agreeable for your members, but we haven't heard from them, so apparently it's by default going to be the move to get it reconsolidated in a way where the delivery of local benefits will be there for all the members who need it. So that's kind of a picture of how things are going to look like and what we anticipate it will be going forward with this year's renewal. 2026 dues billing will be based on these new mergers and new basic local societies, around 24 total local societies remaining. Hopefully there'll be another question or two at the end, but if not, it's time to move on to the next presenter we have. Dr. Charlie Incalcaterra is going to talk about some other restructuring in PDA's governance that's pending, bylaws changes being written as we speak. Dr. Incalcaterra.
Thank you, Ward, and thanks for everybody for being here tonight. I'm happy to spend a few minutes reviewing what the Sigma governance team did for the Strategic Forecasting Committee. So one of the things that we were tasked with, a number of things we were tasked was to look at how the committees in the PDA can be more efficient and how we can reduce redundancy. For example, there are a couple of committees and advisory groups and task force that were working on the same project, the same issue. And that was really kind of not really a very efficient way to run our governance. So we're looking at that. We were looking at how the committees can communicate within each other and amongst each other in a better manner so that everybody gets to know a little bit more about what's going on with each of the committees. And then take a look at our structure of our task force in the PDA. So what we decided to do, and I don't want anybody to who looks at ADA councils to think that this is related to the ADA. We just did some nomenclature to kind of make things a little bit more convenient. But what we decided is to have 3 main councils. And the first one you can see is Membership Activities Council, which would consist of the Membership Committee, the Concerned Colleague and Wellness Committee, which is something new. We're going to talk about that. Diversity, Equity, and Interprofessional Relations Committee, which is also a new change in name. And then New Dentist and Dental Student / Resident Relations. So they would be under the Membership Council. And as you can see, the chair of membership would be the chair of that particular council. On the right, you see the Government Relations Activities Council. This would consist of government relations, and the chair would be the chair of that council. Dental benefits, and then access to oral health and education promotion. And then the third one would be the Events Activities Council, which it consists of the annual session, again, that's the chair of the council, continuing education, which is a new committee, annual awards, and then vacation CE committee. Next slide, please. So just wanted to note that the Communications and Public Relations remains a standalone advisory group that's not going to be grouped into one of these three councils. So what's new? The Concerned Colleague in Wellness is now a merger of the Concerned Colleague Committee and the Advisory Committee, the Wellness Advisory Committee, and the Mental Health Task Force. So that's combining those that are kind of doing the same thing into one. Diversity, equity, and interprofessional relationships will establish relationships with the PA Medical Society, the Pennsylvania Academy of General Dentistry, the Hygiene Association, PCOH, and other relevant organizations. So it gives them an additional task of interacting with our colleagues across the state. The new dentist and dental student resident relations, I'm just going to refer to my notes real quick because we had a little trouble with the slides earlier. But this will develop closer relationships to the dental schools, ASDA, the dental deans, and the residency program directors to address emerging issues and opportunities relating to the educational programs, how they would work with the membership, and they would work with membership on outreach programs to the dental students. You know, for example, signing day. We thought about who's best related or can relate culturally and age-wise to the dental students, and we thought the new dentist committee would be a great bridge for that for the PDA. So that's our hope, is to have them do some of that outreach to the dental schools and to the residency programs. And I know Jay Friedman's on here, was a big advocate of the residency programs being more. So, you know, thanks to Jay for that recommendation. Continuing Education Committee is new. This would, because a lot of the districts used to do education, and it's going to fall on the individual tripartite locals. We were hoping that the Continuing Education Committee could create a speakers bureau to assist the locals in finding speakers for their programs and suggest courses and speakers to also to the PDA staff for the CE programs held at the annual session and the family vacation CE. So this is something new that we thought would be helpful. And then environmental issues and election advisory committees, instead of making them committees, one is of the board and the other was an advisory committee that exists alone. We thought that because they're infrequently really used at this point with the change in elections that we have in the PDA, that they would be considered more like task force that could be called up when an issue arose. So they would still be existing, but not having a standalone committee, but more or less a task force type of activity. Next slide, please. So I just had a meeting with Dr. Peter Korch, who's our bylaws chair for the PDA, and we had discussions about what we name things. I actually wanted to, at one point, call everything rapid action teams, but the acronym is RAT, and people didn't like that, although I thought it was really appropriate for what they do to be rapidly acting when an issue came up. So the nomenclature is kind of under discussion right now, so you see those different things: task force, reaction teams, response opportunity teams, et cetera. What we thought is that these key teams would be composed of experts across the various fields or people who are very interested in serving on these committees or task force to respond not only to future threats that the PDA may face, but also opportunities. And some of the examples we came up with, which would possibly be issues that might come up in the future, again, as a strategic forecast, and we're predicting what could happen in the future, we're trying to do that. So workforce threats such as dental therapists or the ability of FDAs possibly to perform hygiene services in our offices, those are threats and opportunities. Practice models and regulations, emerging technologies, artificial intelligence might be something that people would be interested in working with. And again, public health management and oral health coalition, that should be oral health coalition. Addressing issues that come up like water fluoridation and the pandemic response. You know, with water fluoridation, right now our government relations committee already has an agenda, and they're now going to have to take their eye off the ball if they have to work with, you know, public water fluoridation. So maybe if we had a standalone task force or reaction team, that would help to alleviate some of their burden too. Each committee would have a chair and a vice chair. The vice chairs or the council chair would meet together right before the board meetings, and each committee would report their information to the council chair. That council chair would then put a document together that they could share with their board liaison. And again, that would help to improve communication within the councils, and then the board would be able to have 3 reports or so that they would have to disperse to each other. And we think that would be a lot more efficient for communications as well. Is there one more slide? Yeah, so we decided on the makeup of the committees. The recommendation is, since government relations, currently it's 1 member from each of the current districts, which are going away. And we thought that was a good model, that we should have 10 or maybe 12 or 13, depending on the number of trustees, because we want to have broad continuity with our House and Senate members across the Commonwealth. So that was one committee that we recommended that it stay as a larger committee. But other committees can be more lean and mean. The numbers don't have to be prescribed, composed of members who have a strong desire to serve or relevant skills and knowledge. We thought that we should engage the what's formerly the 10 under 10 people. Those are now called the emerging leaders, our leadership academy participants, and members directly. We feel that the task force, or whatever you want to call them, would be very interesting for people who may have an expertise. Again, if you're looking at artificial intelligence and somebody has good knowledge on that, they may be interested in serving on those committees. So that's our aim, is to populate the committees and other working groups effectively. And I think that's the end of my presentation, unless there's anything else. No, that's it.
No, thank you very much, Dr. Incalcaterra. And I will say personally, that team sounds like a great for me, but yeah, you were voted down. With that, I'd like to turn things over to our government relations chair, Dr. Linda Himmelberger, to get us several items to talk about. While the budget is unfortunately not one of them, we have been busy. Dr. Himmelberger.
Yes, good evening, everyone. And for those of you who are on the edges of your seat wondering what's happening with the Phillies game, I'll give that update first. Bottom of the 3rd, looks like Brad Marsh just got on first base. So score is still 0-0, which is the best score we can hope for right now. So let's continue on. I won't show you my shirt that says "Never underestimate a woman that understands baseball." So the first area I want to look at here is our state legislative and budget update. As Ward just alluded to, those of you who have been following the news knows that we are in the midst of a budget stalemate, which is largely derived from disagreements over mass transit funding and skilled games of chance. But its impact is being felt across the board because nothing's really moving through the legislative process, while the House and Senate leaders are focusing on the budget negotiations. But even though nothing is going through the process, we are still continuing to advocate. We're still continuing to reach out to the members of the legislature to talk about dental insurance reforms, like our credentialing reforms and dental loss ratio reporting. We're also actively monitoring literally hundreds of other bills that have been introduced to determine whether or not they have a potential impact on dentistry. And I think this is one of the areas that our members and perhaps even our non-members see the 1 or 2 or 3 bills that we are trying to move through the legislative process in any given year without realizing that there are hundreds of bills that we are reviewing to see what the impact is and to raise our voices when we see something that we believe could impact our profession, either for good or for bad. One of the other areas that we've been focusing on this past summer was that we made sure that we were represented at a legislative hearing that was held over the summer to address access to dental care in rural Pennsylvania. Next slide. And speaking of rural health care, in September, the Centers for Medicare and Medicaid Services, CMS, opened an application process for funding through the Rural Health Transformation Program, which was authorized under the One Big Beautiful Bill Act. And the purpose of this is to address disparities in access to care and health outcomes for individuals living in rural areas. And this is something that we as practitioners and we have as an organization have had our eyes on for a long time. The fact that there are disparities is nothing new to us, but this new initiative has the opportunity to bring literally millions of dollars into the Commonwealth, specifically to address issues having to do with oral health in the rural areas, again, of our Commonwealth. So the Department of Human Services, DHS, solicited feedback from stakeholders for what kinds of programs could we suggest, innovative solutions related to mental health, maternal health, aging and access, transportation, and most importantly for our group, rural healthcare workforce issues, which we know has been a huge issue for us. So the fact that they reached out to us asking for our input, I think is indicative of the strides that we have made and the position that we have as the trusted source for information in Pennsylvania. So next slide, if we could, Michelle. In our recommendations, we wanted to highlight ways to attract and retain more dentists and dental team members to Pennsylvania. So I think the first one was really a no-brainer, was to raise insurance reimbursement rates, both for private insurance as well as public insurance, in other words, Medicaid. We're also suggesting ways to incentivize dentists to locate to an area and stay in that area, including offering scholarships and retirement programs, tax breaks, student loan repayment, and government-backed loans to help our colleagues purchase dental practices in rural areas. We're also suggesting that we look at the CDHC, again, the Community Dental Healthcare Practitioner. We were a pilot for that program a number of years ago. We have the pieces of the puzzle. We need funding and we need an opportunity to pilot that in some of these areas. If you recall, for those of you who may or may not be acquainted with the CDHC responsibilities, they would help with prevention, facilitating care for patients, to speak with them and help reduce the incident of missed appointments, dealing with transportation, any other barriers to access that will help people get from point A to point D, the dental office. And last but not least, improve the broadband capability. Again, for thinking about opportunities in telehealth, also helping with the CDHC as they reach out to patients to find out what their barriers are for getting back into the office. Next, okay, just going back, sorry, one slide. The great news is that we've been assured by the DHS that whatever application they submit to the federal government, to CMS, will in fact include oral health initiatives to help address these disparities. So I think that is really exciting news. On the federal front, we have been working with ADA to find a sponsor for what's called the Waiver Act. And this would permit a waiver from ERISA preemption on state-based insurance laws. So in other words, on our credit card law, currently doesn't apply to ERISA plans. With this Waiver Act, we could expand it to include ERISA. And I want to give a shout out to Drs. Incalcaterra and Walbridge, who met with their congressperson, Congressman Ryan McKenzie, to ask him if he would sponsor this act on behalf of the ADA. And last I heard, he's considering it. Haven't quite reeled him in yet, but at least we, hopefully have him on the hook. So again, thank you to Drs. Incalcaterra and Walbridge. Next slide, if we could, Michelle, thank you. And Ward did touch on this a bit yesterday on the Front Street 411. I just wanted to talk a little bit more about it. So I'm sure that you all are aware that in February of 2024, the ADA issued new recommendations on the use of shielding for conventional X-rays as well as cone beam. So bottom line is that the ADA is advising that we discontinue the use of lead aprons and thyroid collars. Not all of the states yet are completely on board with these new recommendations. Pennsylvania is slowly but steadily getting there. Right now, in consultation with the DEP, that's the Department of Environmental Protection, they have agreed that yes, we don't need lead aprons, so no more lead aprons are required. They are still indicating that thyroid collars should be used, particularly in the pediatric population. Right now, we're waiting for an update from the DEP. They've been looking at the regulations, the recommendations. They've been looking at the research that the ADA relied upon in making these new recommendations. I don't know what the DEP is going to say in their new update, but just rest assured that the PDA has our eye on the ball, and we're working to bring Pennsylvania in alignment with the ADA recommendations. And last but not least, there will be a pilot program at the Three Rivers Dental Conference. Our sponsor for this evening's broadcast and one of our endorsed vendors, Clym, C-L-Y-M, will be collecting lead aprons at the Three Rivers Dental Conference because, of course, disposing of lead, which is a heavy metal, we don't want it in the landfills and we don't want it in our, incinerators. So this way it will be collected and recycled in a safe and effective way. And I think that's all I have for tonight's update on government relations. Not sure where the Phillies are at this point. Looks like the score is still nothing, top of the fourth inning.
Thank you very much, Dr. Himmelberger. A lot of stuff going on in the governmental affairs arena, even though there is a stalemate at the Capitol and apparently a stalemate in the ballpark. Moving on now, I'll let our president, Dr. Rockwell, who is only able to join us with audio tonight. We had some technical issues, but he's got an update on several things going on at PDA. And Ted, although we can't see you, hopefully we can still hear you.
All right, everybody. Hello, good evening. I'm glad you're here. I'm here in voice and in this October Halloween month in spirit also. The pre-meeting caucus was held on September 27th. First slide, Dr. Paul Reese was nominated and elected unanimously as our ADA's 3rd District Delegation Secretary. Next slide, please. After the election, we started the reference committee caucus leaders presenting. Dr. Sonia Satia began and the discussions presenting a resolution passed at the July BOT meeting, which would make it easier for internationally trained dentists who are eligible to work in the United States to practice as a dental hygienist. Dr. Jim Tauberg noted U.S. Senator Bernie Sanders from Vermont is including in his proposals on U.S. legislation that internationally trained dentists have a pathway to allow them to practice as U.S. dental hygienists to help reduce the workforce shortage. Dr. Satia also noted that there are other proposals in the works for a resolution for the 2026 ADA House of Delegates that will work hand in hand with the spirit of the resolution from the BOT. It was decided to revisit this resolution in 2026 and submit an appropriate one that considers all these factors depending on how they develop. Candidate questions were developed for the two VP candidates for ADA and the 2 speaker candidates for ADA. The slide with the candidate information for second VP. Dr. Meredith A. Bailey, DMD, MS, is a candidate for ADA second VP. She is the Massachusetts Dental Society president and media past president and was the MDS VP for 2 years. Her ADA positions held included chair of the ADA Council on Ethics, Bylaws, and Judicial Affairs, chair of Standing Reference Committee on Constitution and Bylaws, Administrative and Policy Review Subcommittee Chair, and Election Commission Chair. Dr. Ben Yule, DDS-MS, is also a candidate for ADA second VP. He has been an Illinois State Dental Society trustee, a vice president of the American Student Dental Association, and a Chicago AGD officer. His ADA positions held included ADA Finance Committee, ADA Council on Membership, ADA New Dentist Committee, and ADA Council on Scientific Affairs. To the question, who will you be working for, both second VP candidates responded for the House of Delegates, with Dr. Yule also stating that the House represents the members. Dr. Deborah Peters, DDS, is a candidate for ADA Speaker of the House. Dr. Peters is past Speaker of the House and President of the Michigan Dental Association. Dr. Peters' ADA positions have included Chair of the ADA Council on Membership and Council on Ethics, Bylaws, and Judicial Affairs. Dr. Ralph Howe, Jr., DDS, is a candidate for ADA Speaker of the House also. Dr. Howe is former Speaker and President of the Virginia Dental Association. Dr. Howe's ADA positions have included ADA Council on Dental Practice, Council on Communications, and Secretary, Treasurer, Parliamentarian, Vice Chair, and Chair of the 16th District Caucus. After the Zoom meeting, another question was developed by the 3rd District Caucus and emailed to Dr. Peters. So if we go down to that slide with the answers to the, what do you see as your role at ADA Board of Trustees? There's 2 slides with the long answers they gave. I'll give the short of it. Dr. Peters and Dr. Howe both stated that the speaker shall serve as the parliamentarian of the Board of Trustees and assist with a well-structured board meeting. Dr. Peters ended with the speaker has a responsibility to ensure that the board deliberations follow sound governance processes. And Dr. Howe ended with the parliamentarian would serve as a resource for new resolutions to assist trustees in format as well as what policy they would replace, augment, or change with their pending action. So right now, we'll go down. If you want to look at the answers in more detail, it's there. Go past those slides and go to Reference Committee A, Budget, Business, Membership, Administration. I'm going to give a few brief overviews of some Reference Committee resolutions discussed. There were many, so just a few brief ones. Many resolutions in Reference Committee A are seeking to deal with ADA governance with the goal of transfer of more oversight to the House of Delegates. 201 seeks to create a standing committee of the House of Delegates to oversee the budget in conjunction with the BOT, and the board voted no because it feels all members are entitled to this information, and 2 strategic forecasting members have been added to the Board Finance Committee. Reference Committee B primarily clears up a lot of previous ADA policies. Resolution 309 in B stands out because it relates to Pennsylvania legislative efforts. 309 revises the title of the ADA policy to assignment of benefits. So it's to the assignment of benefits from the previous authorization of benefits. This policy supports a dentist's right to accept or reject assignment of benefits and a patient's right to assign benefits to the treating provider while opposing third-party repricing. The board voted yes, and that has always been a goal of our legislation in Pennsylvania. Resolution 407 in C was submitted by CDEL, and it states that the ADA urges the Council on Dental Education and Licensure to develop pediatric guidelines for the use of sedation and general anesthesia by dentists, reflecting the unique clinical and educational needs of dental practice and the distinct considerations in pediatric care, with a report for the House on 2026. The board voted yes on this. This will draw a lot of controversy from the pediatric specialists because the pediatric community believes these guidelines should be more appropriately left in their hands, as it has been and currently is. And then a very significant resolution in D is 502B. It states that the ADA encourages all state dental associations to advocate for laws to require state dental boards to require clear and accessible disclosure of dental practice ownership and financial control for the benefit of patients, including the names of the dentists legally responsible for patient care and the name of any DSO or non-dentist entity exercising control visibly posted in the dental office, on the practice website, and on marketing materials. The purpose is transparency for the public, and the board voted yes on that one too. So after discussions of all the resolutions of the reference committees, our very own Dr. Jim Boyle visited our 3rd District delegation and asked for comments on his campaign presentation after he gave it, including suggestions for ways he might improve the presentation. The delegation also asked him a lot of hard questions to help Jim prepare for his continuing campaign on his way to ADA President-elect. And the only other thing I wanted to bring up was, please don't forget that in January, we have the Leadership Conference, the 30th and the 31st at Seven Springs Mountain Resort. The BOT meeting will be from 8:30 to 4 on the Friday the 30th. Dr. Oakley will present a leadership topic at 6 p.m. on Friday. Jackson Kirchis will present a leadership topic on Saturday morning. Dr. Savendra Vijan will present on digital dentistry, and Herb Ray will present on endo. That is basically my report. Thank you very much.
Thank you very much, Dr. Rockwell. Lot's been happening there. We're going to shift gears now to the ADA portion of the presentation tonight and hear from our CAP rep, Dr. Janine Burkhardt. Dr. Burkhardt.
Hi, everybody. We do have a handout that's posted with tonight's webinar, so you'll have all this information afterwards, because I'm just going to do a high-level overview of the slides. So on the next slide, these are the topics we're going to review. So this is what I like to report out on, because they're the general topics that CAP is always working on. And you'll see on the next slide what our committees and task force and working groups are for CAP. We keep very busy. Next. So these are all the groups we're involved in. On the next slide, it's one of ADA's goals with promoting healthy behaviors. These are also a lot of the areas that CAP has involvement in. A high priority topic that you're probably all aware of is fluoride. I feel like it was just last year I was here giving updates, and it's just more in the news this year. So fluoridation facts, we released a new one in June. So far there's been over 25,000 downloads. It is free, so please promote this amongst all members. There's been a lot of fluoridation challenges the ADA has supported when states have requested help. We did find out that in PA there were a couple of rollbacks that ADA wasn't aware of all of them. So if you have any rollbacks in your districts or regions, please let us know so we can get that on the radar of ADA so they can help support against that. We started a fluoridation ambassador program, so they meet monthly with a lot of advocates across the country, and also supported introduction of the Protect Our Teeth Act legislation. I'm echoing somewhere. We also have fluoridation engagement. So we've engaged in a lot of regional meetings, added a CBJA representative to NFAC. We've had a lot of collaborations. Next slide. And then on social media, the ADA has also been really involved with a lot of engagements, impressions, reaches, and clicks. There was a clip with Jimmy Kimmel earlier on in the year when Utah was looking to take fluoride out of the water, And Jimmy Kimmel had referenced actually what was going on in Calgary at the same time, and how they had taken fluoride out of the water, and now we're spending millions of dollars to put fluoride back in because of all the intravenous antibiotic therapy that they were then using at the Children's Hospital. But the ADA took that opportunity to engage in some of the comments and posts with that clip. The HPI released a brief. They talked about projected increase in costs if we were to eliminate fluoride from the water. So I've highlighted for PA, our projected cost is over $1 billion. So this is a good figure to use if referencing the importance of keeping fluoride in the water. The National Advisory Committee of Health Literacy and Dentistry, they created a tool that they developed for the National Association of School Nurses, which is how to manage dental emergencies. And they're looking for more ways to get involved with them on an ongoing basis. NACLD also, they're working again on the health literacy video contest. So they do host this annually. So on the next slide, you'll see some of the details of the contest. The deadline was actually just extended. So now the deadline is through October 20th. All of the ASDA reps have been contacted about this, but in your districts, if you are involved with the schools, please promote this as well. There's some great videos they made last year. On the next slide, we're also working on things with diet, sugar, and nutrition, as well as tobacco and nicotine. ADA, they co-signed a letter urging Congress to restore funding for the CDC's Office on Smoking and Oral Health, and really warned of how reversing that can really reverse decades of progress that we've made. Brushing has been another hot topic, and this is another one we also can use your help in here in PA. So the Promoting Healthy Behaviors Joint Subcommittee reviewed and revised promotional material from the Consumer Healthcare Product Association. They're looking to distribute educational material throughout the country, and they've also selected certain districts and states in order to receive some toothbrushes, floss, different products. So PA was selected as one of the 9 states, specifically Montgomery County, for 3 elementary schools, and they want to ship us about 4,500 products, and we're still having trouble making a good contact at those schools. So if anybody here has a good contact, please connect with me. We'd really love to donate them products, but without their approval, we can't do that. And then Lancaster County will be getting some of the educational materials. For brushing, there was also a House bill introduced for HSAs and FSAs to cover toothpaste. And then National Children's Dental Health Month is another hot topic, as usual, that we're really proud of. You may have noticed this year that we no longer have the posters available and as paper copies, and that was done intentionally with the goal of kind of promoting this year round, that the resources are always there. And then finally, we'll close out with increasing and improving dental coverage and access. So the main topics we look at there are Medicaid and Medicare. So we'll breeze through these so we save time for Dr. Boyle. The next slide is going to show everything that we've been doing for Medicaid. So we have a research brief, what happens if the adult Medicaid benefit were to go away. ADA has coordinated a lot of efforts with the Big Beautiful Bill. We've posted a webinar recording for understanding the gaps between adult Medicaid beneficiaries and dentists. They've improved their educational resources online. And then we also have the Medicaid pilot program that PA has been involved in as well. More recently, the ADA Medicaid Joint Subcommittee has been focused on developing a financial sustainability toolkit. A number of you answered the survey, so thank you very much for that. They have a draft ready, so this final one should be out soon. And then we have Resolution 520H. This was something that got sent to CAP after last year's House to develop a report on, so that we could determine if CMS was enforcing network adequacy. So we did finalize that, and we shared the future steps or recommendations for that back with the board. The overall finding was that CMS has not enforced compliance with the Medicaid Act, and only 7 states are meeting network adequacy. And then the final piece is for Medicare Advantage supplemental benefits. We created an infographic. It seems that there's a lot of confusion about Medicare Advantage and what that entails. A lot of commercials will advertise that it includes dental coverage, but really only 8% of dental plans across the United States actually include a dental benefit. So the infographic highlights a lot of that and some of the misconceptions and some of the opportunities. I do have my email and my cell phone on the next slide if you need to reach out to me. I know it was a lot, but the handouts are there as well.
And just a reminder to everybody, as Dr. Burkhardt said, if you look on the control panel, there should be a little gray area with white that says handouts. There are actually 2 of them posted there, and you can download them onto your computer anytime during the webinar. Just as you can also type in your questions at any time. We're going to hopefully take a few after Dr. Boyle and Dr. Davis are done. I'm going to turn the program over to them now, though. They've got lots of stuff to talk about with the campaign, I believe. Dr. Boyle.
Thank you. The campaign's going well. 3 weeks from today, folks, is the election. I want to thank everyone in Team Pennsylvania for all your help and input. It's been extremely valuable. We just got back from Boise, and it's pronounced Boise, not Boise. Boise, Idaho, beautiful place. If you're looking for some nice getaway for a weekend, consider Boise, Idaho. It's awesome. But we visited with the 11th district, had a great time. Just some talking points, because I know as those of you that are going to be going to DC, I want to give you some things that maybe separate myself out and might answer some concerns that our other House members have. One is to transparency. And feel free to discuss that I authored the resolution that you've seen in the packet, which directs all quarterly financial reports be emailed to House members with direct link to the reports. This is the difference. Before they were just put in, and you can all see them. All these financial reports every quarter are put in the ADA Connect under the House members folder. But now when they're filed, if the House supports this particular resolution, they will be emailed with direct links to the reports if you wish to look at them at that time. The other thing is, as chair of the Finance Committee, all trustees are invited to listen in on all Finance Committee meetings. All Finance Committee reports are shared with the Board of Trustees. So everything that the Finance Committee shares is shared with the board, because the board is the one that ultimately approves the spending in the budget. The other thing regarding finance, as finance chair, I created a budget advisory group, which is headed by the treasurer, because that's the treasurer's job description, and includes trustees and House members. What they're doing, this is unprecedented in ADA at the board level, they're interviewing, this budget advisory group, interviewing senior staff department heads as we form the 2026 budget. We're looking for efficiencies in programs and ways of cutting expenses as well. So again, the people that are not participating in these interviews are the executive director, the president-elect. These are the senior VPs being interviewed and going through their budgets with the finance budget advisory group. This has never been done prior to this year. So again, just some couple of talking points. Some other things. I'm the current chair of the ADA Forsyth Institute, and we've been working on creating new streams of non-dues revenue by leveraging our scientific reputation. So I think that is all I had, and I'll turn it over to Dr. Gary Davis, who's doing a great job traveling with us everywhere. So we were just in Idaho. We did a Zoom with the 14th district. Previous to that, we were in Illinois, in Texas, and in Wilmington, Delaware with the 4th district. So thanks, Gary. Go ahead.
Yeah, you can go to the next slide. We don't have much time. I listed some of the visits and some of the Zoom meetings we had. Basically, I just wanted the leadership in the PDA to know that Jim and I and our team have spent many, many hours on this campaign. I calculated the hours traveling, the hours in meetings, the time in phone calls, and I've spent over 900 hours on the campaign, and Jim has spent a lot more in that, practicing his speeches. So he's probably at 1,200 hours, on work for this campaign. So we've done a lot of work, and we feel pretty good about the campaign. At the moment, we do have, I think, we'll have 4 people running for president-elect. And just talking about the meetings really quickly, for the last 24 months, every Tuesday, we've met with a campaign consultant for at least an hour. And once a month, we've been speaking with a marketing and speech training consultant. and we've done a lot of fundraising. And I want to thank all the fundraising leads in each district in the PDA, because to do all this traveling and to have the consultants that we are using, it takes a lot of money. And so I want to thank you for that. And then for the last 18 months, we've had an executive committee that met once a month, and now we're meeting every other week. And they review and approve some of the, or most of the campaign decisions. They give feedback to Jim on his speeches and publications and the media we send out. They just give general advice to us, and they get intel for us on each of the states that we visit. Next one, please. So we need your help during the annual meeting. We have different groups of of people that support us. We have intel gatherers. I call them secret agents. So people that go around and find out what other states and what other members are thinking and what their concerns are. We have canvassers. There are people that will go out and talk to people and introduce them to Jim. I still need some volunteers for the caucus walk team. So if you have a good relationship with an influencer or a leader in any of the districts that we're going to, please give me your name, and I might invite you to be one of our caucus walk team members. We're not going to use the same team for all 17 districts, and we're going to be strategic. And if you have a contact in a specific district, we'll ask you to be there. One thing, we have our nominator on the floor will be Rupali. We have an election observer, that's Charlie. Thank you both for doing that. We need reference committee note takers, so people to take notes during the reference committee hearings and report to us what states and what districts feel strongly about. And then lobbyists, we need all of you to share your support or help with Jim in the campaign. I'm going to ask you for some favors. So Jim will be very busy during the annual session. He'll be interacting with hundreds of people, delegates and non-delegates. He has a very important speech in front of all the delegations and guests on Saturday afternoon at the first meeting of the House. And we believe this speech is key. Jim must focus on this speech. It's really important. He also has caucus visits all day Monday. We start at 7:30 and we end around 2:40. So it'll be a long day for us. So for these reasons, I'm respectfully asking you not to color his mind during the annual session. Before the annual session, if you have any ideas, any concerns, please share it with us. But during the meeting, can we go to the next page? If you have any suggestions or intel about the campaign, so anything about his speeches, anything about visits that he goes on, that kind of thing, please talk to me or talk to Charlie. Now you have work to do. I'm getting feedback. As a delegate and as a member, you have every right to go with Jim, and so we don't want you to be afraid to talk to Jim about the issues. So if you have a resolution that you're concerned about or some other issue that keeps you awake at night, I think it's your job to talk to Jim. So please, talk to him. He will need your support and your friendship during, this annual meeting. But like I said, anything that's dealing with the campaign, please come to me. So, if you have any suggestions on what to say during his speech or anything like that, talk to me first. I don't want any confusion out there. The speech is so important, and we've gotten feedback from our executive committee. We've gotten feedback from consultants who have worked with other campaigns in the past. And as you heard earlier, even our 3rd district delegation gave feedback to Jim already on his speech. So we're using that information, but during the annual session, please, any campaign things, come to me or Charlie. Any concerns you have about resolutions, please talk to Jim. And that's all I have. And you have our information, contact information there at the bottom of the screen.
In a word, if I could, the only other thing I'll add is that with the Ravens' recent performance, I've been able to really concentrate on the campaign. Just one quick thing to say regarding candidates running from the floor. My position simply is the more the merrier. Our governance supports it. They want to do it, fine. The additional question that needs to be asked is, our governance does have specific requirements for treasurer and speaker. They have to be vetted and qualified before they go on the ballot. So that question is, what should the qualifications for a president-elect be? So that's how I answer that question, just so you all know. Thank you. Great job, Gary.
Thank you. And, you know, and anytime you work with Jim, you know, Jim is, you know, passionate about things. And so we pretty much have a phone call every day. So that's part of the thing too. Every day we talk about something. So he's doing a good job for you. I think he will represent you very well. And I feel very good about the campaign.
Sure. I really appreciate that. And I've been in on a few of those campaign meetings, and I can testify.
You've been on many of them.
Yeah.
Many of them.
Yeah, just to our audience, yeah, Dr. Boyle is working extremely hard and very deserving of your support. I'll just leave it at that, but it's been impressive. I knew there would be at least one question here that was not dentistry related, and Dr. Talberg is not disappointing me. This would be directed for you, Dr. Boyle, and it's more of a comment. It's about time that you've admitted Raven inadequacy.
Talk about not sleeping at night.
Yeah, I gotta say, it's much more distraction than you need. We need Jackson healthy again. Are there any other questions? We have just a couple minutes here. We can take them, but we did get a late start, so we might bleed over just a touch, but we're also bumping right up against the limit on time. Any questions from any of the panelists for another panelist by any chance? And no more Ravens comments. Well, I tell you what, I am going to allow Dr. Himmelberger to give us one quick Phillies update, and we'll let that be the last word. As soon as she can unmute. Still tied 0-0.
Bottom of the fifth.
Okay. Sounds like offense is lacking in both Baltimore and Philly these days. So what can we say? Everyone, thank you very much for joining us this evening. In all seriousness, we covered a lot, and we appreciate your attention. Bear in mind, though, if you have colleagues who might be interested in this information, or you just need a refresher or didn't catch something, fix yourself a little dinner in the middle of this and miss something. It's all recorded and it's available on the webinar and video library on the PDA website. We'll be doing this again in 2 months. We really expect to have a good program for you every time, but that will be the last one of the year. So we hopefully will have a lot of information report back on the upcoming board meeting and the annual session. So please join us December 2nd. Till then, thanks again to all of our panelists tonight. We very much appreciate the great updates, and we look forward to seeing everyone in December. Till then, happy Thanksgiving, happy Halloween, and good evening.